At some point in our lives, we've all heard about some sort of rare disorder or disease that has been inflicted on someone. But sometimes there are medical conditions that, although they may seem rare and unusual, are a lot more common than one would tend to think. One of these fairly common conditions is a prolactinoma. Prolactinomas are a typically non-cancerous tumor of the pituitary gland, according to Mayo Clinic, and is a condition resulting in the overproduction of the hormone prolactin. These benign tumors are also called adenomas. Today, I'm going to inform you about the pituitary adenoma, more specifically called the prolactinoma, by first, the symptoms, second, the process of diagnosis, and finally, the treatment regimens. I'm also going to tell you about my personal experience with the tumor. I was diagnosed with a prolactinoma in August of 2011 at the age of 16, and throughout this speech, I will share my story with you. First, let me tell you about the symptoms of a prolactinoma. According to Medline Plus, the symptoms of women include abnormal lactation in women who are not pregnant or nursing, breast tenderness, decreased sexual interest, decreased peripheral vision, headache, infertility, irregular or non-existent menstruation not related to menopause, and vision changes. Looking back, my symptoms began occurring at an early age. I had started to get regular migraines at the age of 12, happening a few times a week. Over time, the migraines became more frequent, hitting every other day, and sometimes I had migraines that lasted 3 days. What made me finally decide to go to the doctor was a year-long absence of my period. I hadn't thought anything of it for the first 6 months, because from the very beginning my cycle was very irregular, and sometimes was absent for a full 3 months. According to Medline Plus, the symptoms of men include decreased sexual interest, decreased peripheral vision, enlargement of breast tissue, headaches, impotence, infertility, and vision changes. Here I have an example of the enlarged breast tissue of men. This is with the increased prolactin levels, and this is normal. However, there could be no symptoms at all, especially in men. The lack of symptoms means many individuals are unaware that they even have the condition, and for this reason, prolactinomas are much more common than anyone can ever say. Second, I will share with you the process of diagnosing a prolactinoma. According to Mayo Clinic, a patient that is believed to have a prolactinoma will undergo blood tests, brain imaging, and/or vision tests to diagnose the condition. Blood tests come first. They detect overproduction of prolactin, which results in higher prolactin levels in the blood. If loss of periods occur in women, a pregnancy test will be administered to rule out the obvious possible cause. When I finally decided to go to the doctor, the first thing they did was give me a blood test. This was a combined pregnancy test along with a hormone test. My prolactin levels came back to be 3 times higher than the high end of the normal range. At that point, my doctor gave me a referral for an MRI. MRI scans can show the presence of a pituitary tumor on the films. This can also show the size of the tumor in question. After my MRI, it was confirmed that I had an intruder in my brain. My prolactinoma was only about 6 by 8 millimeters in size, which is considered to be a microprolactinoma. Macroprolactinomas are those in which are larger than 10 millimeters. While I don't have a copy of my own scans, I can show you pictures of others. This is an example of a microprolactinoma. This is the pituitary gland, and that small little shaded dot right there is the microprolactinoma. And this is a picture of a macroprolactinoma. Again, this is the pituitary gland, and this big dark spot is the macroprolactinoma. Vision tests can determine the growth of a tumor that has been impaired a patient's sight or peripheral vision. The doctor may also refer the patient to undergo more extensive testing through a specialist called an endocrinologist in treating disorders of the endocrine system. Last, I will explain the various treatment regimens that an individual with prolactinomas may undergo. UCLA Health says that there are 3 main courses of treatment for an individual with a prolactinoma: medication, surgery, and radiation therapy. Medication is the first line of treatment. The doctor prescribes medication that mimics the effect of dopamine, which is the chemical in the brain that normally hinders the release of prolactin. The most commonly prescribed medications are cabergoline and bromocriptine. Cabergoline is usually the preferred medication because it uses an easier dosage schedule. Bromocriptine is an older drug that is less frequently used because there are more side effects. 75% of patients respond to medication, showing noticeable reduction in tumor size. Women notice the return of their periods and become fertile again. After 1 or more years of medication therapy, about 1/3 of the patients who respond to the meds are cured with no reoccurrence of the tumor. About 1/2 of the patients require prolonged tumor suppression therapy. Personally, I was sent to an endocrinologist to determine my course of treatment. She decided on medication, and I was immediately started on cabergoline. My treatment was half a pill twice a week, and I eventually was moved up to a full pill twice a week. The medication made me nauseous and dizzy, but it was definitely tolerable. About 1 month after I started treatment, my menstrual cycle returned to normal, and my headaches were virtually gone. I continued getting monthly blood tests to check up on my prolactin levels and went in for an MRI every 6 months. After about 3 years of treatment, I was finally cured. My release from my endocrinologist was actually just this last August. And here I have a picture of the reduction of a prolactinoma after a year. So right here is the prolactinoma, and here's the reduction. You can see it's quite a difference. Surgery is another form of treatment. To be a candidate for surgery, you have to have intolerable side effects of medication, worsening symptoms, and no decrease in tumor size after medication therapy. Neurosurgeons that specialize in pituitary tumor removal use a minimally invasive endoscopic procedure which goes up the nose. Radiation therapy is another course of treatment that can be taken when there is no response to meds and you cannot operate. One of the complications of radiation therapy is a delayed pituitary failure that generally takes place several years after the treatment. Individuals that experience such failure may require hormone replacement therapy. We have all heard of some sort of rare disease or medical condition, whether it is elephantitis or Alice in Wonderland syndrome or somewhere in between. But there are some conditions that are a lot more common than you would think. Today, I have informed you about one condition in particular, the prolactinoma, both generally and of my personal battle. But by first, the symptoms, second, the process of diagnosis, and last, the various forms of treatment.